Thank you very much, and thanks for the opportunity to be with you. And also a big thank you to all of you who've given your time starting even before the formal proceedings in order to enable us to have some, what I thought were really helpful, interesting discussions about some of the current issues about education and training and clinical leadership in the context of how we take forward the white paper and the bill. So thank you for that, and a great opportunity to be with you. I'm sort of kind of sorry I'm not going to be able to stay this afternoon and see what Dancing with Anne Widdecombe is going to consist of. I've never actually danced with Anne Widdecombe. I've sort of debated with Anne Widdecombe. I've never danced with her, but anyway, each to his own. It's always a pity when you come to conferences and you can't stay for too long. Happily, I'm going to have a chance to stay and listen to Bryn. But yesterday I was, first thing in the morning, I was with the Association of Surgeons of Great Britain and Ireland, who were in Congress down in Bournemouth. And after I was on, Mike Stroud, who's a physician from Southampton, was going to be on, who's apparently an Arctic explorer as well. And he was going to talk about keeping going through adversity. So I thought I should have stayed for that one. You know, once a month, when we answer questions, I answer questions with my colleagues in the House of Commons about health. One of the standard questions that introduces part of this is that if I will make a statement about my responsibilities. And when I answer that, I always say, what is my responsibility? My responsibility is to lead the NHS in delivering the best possible outcomes for patients, leading public health service in securing continuous improvement in the health of the public, and leading the development of a long-term reform of social care which will protect amongst the most vulnerable in society. So from my point of view, I define my job as leadership. But in relation to the NHS, you know what the job of the NHS, of the Secretary of State in relation to the NHS has tended to be in the past? It's tended not to be defined as leadership, it's tended to be defined as control. That the Secretary of State decides what happens in the NHS. Well, I actually think leadership is not about control. And from my point of view, I think the NHS needs more leadership and less being told what to do. I want to be clear, and we as a government want to be clear about what it is we are trying to achieve, because let's face it, there's going to be £105 billion and an opportunity to make the best possible, deliver the best possible results for patients using those resources. I actually think we should be clear about what we're trying to achieve, the best possible outcomes, the continuously improving outcomes, but then not try to tell people how to do it. And whether it be in the National Health Service or in the Education Service or in the Police Service or in public services across the board, I actually think the same principles hold true as in life generally. That if you really want to deliver the best results, you need leaders to do it. And nobody in the Education Service says, actually, you know, in order to run really good schools, what we need is to have tiers of education authorities, because they will set the standards and then automatically all of those standards will be met. We've had generations of setting standards in education and people finding that there is enormous variability in schools and the overall performance in terms of standards isn't good enough. In the NHS, we've had endless setting targets, but too little taking responsibility and ownership for delivering continuously improving outcomes. That's where we need to be. And that is about leadership. And just as people say, and you've all been there, and you all possibly know it in your own areas. If you say which is the best school, and if a school was doing badly, people say, well, what we really need is the new head teacher. And lo and behold, a new head teacher arrives, and it turns it round. And within a year or two, you can actually have what were otherwise failing schools that are successful schools rapidly. Are we any different in the health service? I don't think so. I think leadership is exactly what it's about. I have to say, with great disrespect to our educational colleagues, health is very complex. So the leadership we need is actually probably, if anything, stronger, wider, more professionally diverse than is true in the education service. So to that extent, what the NHS needs more than any other public service, perhaps more than any other kind of service or activity, it needs leadership. We're very fortunate in the National Health Service because actually what we have is enormous numbers of highly capable people. when you look around the world and say, which country probably has amongst the best education and some of the best qualified people, some of the best opportunities for delivering a service, because actually we have a service which has an ethos of commitment to the best possible outcomes for patients. Actually rather untrammeled by all of these issues about where's your income going to come from, because we do have a health service which is committed to everybody getting access to healthcare based on their need, not ability to pay. We can be absolutely focused on the outcomes for patients and not distracted into other things. So we have people and an opportunity for delivering leadership. And what I think now we need to do is to really make that leadership happen, so we can give patients outcomes consistently amongst the very best in the world. I think that focus on outcomes is not, the bill, people talk about the health and social care bill. Do you know what I think is the most important things we're doing in the health service at the moment? It is about treating patients at the heart of what we do, giving patients an invariable sense of no decision about me without me. It's not in the legislation, it has to be in the culture. You can't legislate for that. The second really vital thing we're doing is focusing on outcomes. Look at the outcomes framework. It's not in the legislation, we're doing it already. We're saying, look, we need to know how and benchmark and compare ourselves and continuously drive towards better outcomes on things like reducing avoidable mortality, recovery after treatment, quality of life of people with long-term conditions, maximising safety, minimising adverse events, and continuously improving patient experience and patients' reports of their own outcomes. That's absolutely, we've never had a consistent framework of outcomes before. We've just had a set of input and process targets. And that shift into outcomes is absolutely instrumental. They're not in the bill. So the bill is actually about giving us the support to make that happen. But let's always keep our eyes on what really matters. It's delivering for patients through those outcomes, and that's what the leadership is going to be all about. And from my point of view, if we have that focus, the thing that is absolutely at the heart, which the bill is intended to do, is to give leaders greater autonomy, and those who are responsible for delivering care in the National Health Service, the ability to make the decisions that will deliver those outcomes, not to be in a top-down system where people do not feel empowered to take the decisions that they should. And I think as we do that, as we make those changes, we will have an opportunity for and a need for a whole new level of clinical leadership.